drug stops suicidal thoughts in hours. Literally. It's an incredible thing to even suggest. Well, there is a drug. It's called ketamine. It's an anesthetic, and it's now being used by some doctors who have patients in a serious suicidal state.
To Dr. Hanna, can you tell us a little bit about depression and how you are successfully treating patients with the IV therapy, the ketamine therapy?
Sure. There are various types of depression that the psychiatrist treats with simple antidepressant medications, anti-seizure medications, psychotherapy, etc. The IV ketamine therapy is really only reserved for those cases who are treatment resistant, who fail conventional therapy, like treatment resistant depression, very severe case of obsessive compulsive disorder, bipolar disorder, and suicidal patients. So it really has offered hope where there was no hope before for those conditions.
And how does it work? Like, where does this new therapy come from?
Well, there's lots of research that is being done now, even from top university like Harvard, Yale, Stanford, and all of them showed really good success rate with the treatment with the IV ketamine therapy. What I want to emphasize is I'm not a psychiatrist, so I don't treat depression, and I just do the IV ketamine therapy for patients after recommendations or referral from their psychiatrist.
Okay.
So they continue to treat them
how
during
they get
and
to
after.
you. Okay.
Yes, only by referral.
And have you had success with this form so far on some of these more resistant forms of depression?
Yes, I really had great success stories. The most recent one, a young girl who came to me referred from Virginia.
It's been 6 months since I had 10 infusions, and my life has changed dramatically. I went from not being able to function or get out of bed or even like bathe myself or do anything like that, and to now being able to do a lot of those things myself. I hadn't smiled in years. I wasn't able to get away from all of those thoughts, but coming out of it, it was like all of it was out of my brain and I was able to function again. I think ketamine made a huge difference in my depression. So
Calls to the National Suicide Hotline have doubled. And as we remember the lives of Anthony Bourdain and Kate Spade, both lost to suicide, Dr. Sanjay Gupta is out front.
The predominant thought was, I need to be dead. I don't want to be here. And that's for as far back as I ever remember.
Major depressive disorder, post-traumatic stress. Alan Ferguson was 18 when he was first diagnosed. Over 35 years, he tried just about all the medications modern medicine had to offer.
Did they work at all?
No. I can say that now.
Alan picked a day he wanted to die, quit his job, gave away his dog, Zeke, and had a final phone call with loved ones. But almost as an afterthought, his psychiatrist asked if he would consider an anesthetic medication known as ketamine.
I wasn't worried about trying something I had never tried before. I was worried about trying something else that wasn't going to work.
At several hundred centers around the country, doctors have been using it off-label to help patients at real risk of dying from suicide. Some have even referred to it as a save shot. For Alan, it worked, and fast, within hours.
I honestly have never had the experience of waking up and not being sorry that I woke up. I don't use hyperbole, but it is, for me, it's phenomenal.
Alan got his first infusion on May 25th, and his depression went from severe to mild. After a second infusion on June 1st, for the first time in his adult life, Alan no longer had depression.
This is your room.
This is my room.
For about 40 minutes, Alan sat here with this IV hooked up to his arm, a heart rate monitor, and his music.
People talk about hallucinations, dissociations, even out-of-body experience. Did you have any of that?
The first day...
Alan told me it felt like his whole body was on Novocaine, like what you get at the dentist. Ketamine also seems to target areas of the brain that have withered away due to depression and grow new synapses, as you can see in this rat model. None of this comes cheap. Nearly $500 an infusion, with most patients needing up to 6 infusions to start, with boosters every few weeks after.
Since you took ketamine, have you ever wanted to die from suicide again?
I have not had one single thought.
Not a single thought now?
Not one.
I mean, Sanjay, it's so incredible. Obviously, I know, a lot more to be tested and done, but you're talking about something that could work in literally hours as opposed to traditional treatments that either don't work at all or, drug names we all may know, things like Prozac can take weeks or months. And for someone suicidal, that could be the difference between life and death.
That is the big difference, I think. And you're right, this is early days with regard to using ketamine like this. Ketamine as a drug has been around for a long time, but it's just now being tested in these early trials, and they look promising, but it's that rapid onset, I think, how fast it works, Aaron, that makes all the difference. It can take 4 to 6 weeks for some of these other antidepressants to start working. If you are suicidal, this has been referred to potentially as this save shot or as this rescue drug, as some of the doctors have called it. So there's not many things that behave that quickly.